Ladies and gentlemen, students, I am extremely excited and grateful to have the opportunity to interview and meet with someone very important to this world. Her name is Elise, and she is what we'll learn is a fairly local human being from the area, but does an important job. So, Elise, we want to thank you so much for joining us, first of all. And maybe, if you're possible, if you could tell us a little bit about yourself, and then we want to cut right to the chase and go into your job, which is a PA. And hopefully you can help explain to the students a little bit better what a PA is. So, Elise, thanks for joining us.
Yeah, of course. I'm happy to do it. So I'm originally from New Lenox, and I went to the Lincoln Way, so I can relate to a lot of people at Sandburg in that sense. But so a PA is a physician assistant, and overall, just in a broad sense, it's a medical provider. So I evaluate patients, I develop and manage treatment plans, and then prescribe medications. Very similar to what you would think when you're going to see the doctor, that we are trained and educated to practice medicine. The biggest difference is that we practice under supervision of a doctor or in collaboration with the doctor.
Okay, understood. Well, as far as the term PA, when we were talking, it sounds like this is, relatively speaking, a newer position in the medical field. Is that fairly accurate? It's fairly new?
Yeah, it is. It's newer, and it has kind of an interesting background. So the first PA program was out of Duke University in 1960s, and the program and the profession was really developed because as the population was aging and growing, there was just a greater need for access to healthcare. So they needed more medical providers. So the curriculum was loosely based off this fast track training program that they used when there was a significant need for doctors in World War II to kind of train doctors faster. So it started out pretty new, but now there's over 250 PA programs across the country, and it's growing pretty significantly.
Wow, that's 250 colleges offering it. That's a large amount of people. Okay, great. All right.
Yeah.
So opportunities to get that education if you want it, for sure.
Yeah, so when I was applying to PA school, I think there was 2 or 3 in the Chicago area, and now there's like 5 or 6. So it's growing quite a bit.
Well, that's awesome. That's good for my students to know if they're looking to do that education piece, but not go too far. It sounds like there's opportunities super close to home.
Yeah, absolutely.
Right. Great. Well, Elise, if I could then spin back, you mentioned something about how you work in collaboration with doctors. And I think a big question is, could you explain maybe how your training is different than a doctor going to medical school, and maybe a little bit about what your PA school was like? What could students expect enrolling in a program like that?
Yeah, so you don't go to medical school. PA school is actually a master's program. So you finish high school and you get your bachelor's degree, usually a 4-year program. And then you're also they want patient care experience or experience working in the medical field before you get into PA school. The programs are typically around 2 years, anywhere from 24 to 27 months. And the first year of the program is going to be all your academic classes, just kind of a crash course in everything medicine, which is pretty intense but really fun. And then the second year, you go through all of the rotations. So you do all the general medicine, you'll rotate through primary care, pediatrics, emergency medicine, surgery, OB-GYN, and then you usually do your own electives as well, out of interest or what you're going to specialize in after.
Wow. Okay. So that's very hands-on, to say the least.
Yeah, it's pretty fast. It's pretty it's an intense 2 years, but it is you learn a lot really fast, but you're just completely focused on it, and it's a good experience. Everybody has a good experience with it.
So if you're working directly with patients, could you explain, like, what does that mean, like, when you're working with patients and that experience? How exactly did you get that experience working with them?
Yeah, so I had mentioned that to get into PA school, they encourage you and they do expect that you've had some experience working in healthcare before you even apply to get into the program. People get this in different ways. So you can be a physical therapy tech, you can be a medical assistant, can be an EMT, that's somebody who's on the ambulance that helps out with paramedics. I personally got my experience as a CNA. So some people get this experience in their undergrad. They'll do this working when they're in college. And a lot of people they take a year or two off their undergraduate. After they graduate, then they'll do a year or two to get that medical care experience before they apply for PA school. So CNA was, I think, one of, like, I've learned the most from that job. So I'm a certified nursing assistant, and I was able to work in a nursing home, psychiatric facility, and on the hospital floor. And I did this while I was an undergraduate and then for a year after. And it's just, there's a couple things. So it really validated and confirmed that I wanted to work in healthcare, that I wanted to work in that kind of setting, which is huge.
Yes.
It got me more comfortable working with patients and patients' families, because you're dealing with people in a vulnerable, important situation. I think that doesn't necessarily come natural to some people, and it takes a little bit of time to get comfortable in that setting. And then also you just get comfortable with medical setting, medical terminology, just the process of how medicine works, and all that stuff really helps you in PA school. Starts to kind of make sense. Can you put something to it? And then also when you get out of PA school, because there's a big difference between learning medicine in a book and then actually seeing a patient and applying that medicine when you're seeing them. So I think it's really helpful.
Yeah, that you bring up being a CNA and then now you're a PA. Is it a good time to maybe ask a quick question of what do you find the biggest difference between what you were doing as a CNA versus what you do now as a PA?
So a nursing assistant, I was helping kind of with patients, they call it like activities of daily living, just helping them with it was so different depending on what I was doing. In the nursing home, you're basically feeding, bathing, taking care of, doing everything like that for the patient. But then in the PA role, you are evaluating that patient's, you're working more as what you think of like with a doctor. So you're taking more care of that patient's medical conditions and prescribing their medication and ordering the imaging or putting them in the appropriate medical facilities. The field is really growing significantly. Oh, yeah.
As far as becoming a PA, how did you know that this was a profession that you wanted to pursue and have as your career?
Yeah, so and I think if I was in high school, I would definitely like to hear this. So when I was in high school, I had no idea what a PA even was. I knew I was interested in medicine and science, and I think a lot of people can relate to that, but they don't necessarily know what exactly they want to do with that or what route they want to go.
Right.
In high school, I volunteered at a hospital just because I knew I was interested in medicine and I wanted to get my foot in the door and see if I really liked being in that setting. And then I was joining clubs and activities. I did like a medical science summer club one year in high school, and then I just tried to get as many experiences as I could, even just getting exposure as what are the different options of careers available in medicine and science. So that was really the big way. And then when I was in college, I heard from somebody in my class what a PA was, and I just knew that was kind of the right route for me.
I think experience is just a great lesson for high schoolers, whether that's through, like you said, community service or trying out new things, joining different clubs. You really just get new ideas that eventually could, lead to your career. So thank you for bringing that up and highlighting that. We always say that as teachers, but I think we get ignored a lot. So hearing that from you is much more powerful. So thank you for bringing that up. Now, as far as you went to PA school, you got through it, you got all this medical training in that. Where exactly, and you mentioned slightly through my random curiosity questions here, but where exactly do PAs work then after you get that degree, that master's certification in that? Where do you specifically work?
Yeah, so after what I think a big thing that appealed to me about going the PA route versus NP or ND or a doctor or nurse practitioner would be that there's a lot of flexibility in the field that you work. So when you come out of PA school, you can really work in any specialty. So people tend to go more often in primary care, surgery, orthopedic surgery, emergency medicine, pediatrics, urgent care, like ENT, urology. You can really go into anything that you want. And then if you want to do that for a couple of years and you decide you want to try something else, you're open to doing that. So versus you don't do a residency and then you're committed to that. So like I said, I was in emergency medicine for 7 years, and then I just recently switched to urgent care. But I could have switched to, orthopedic surgery, and that would be okay. And if 10 years I decide I want to do something else, I can do that as well. So I think
cool.
that's a huge, huge perk. Yeah.
Yeah, if you get
Absolutely.
bored.
There's a lot of flexibility. Yeah, or just, quality of life and just change of pace and setting, or just exploring different interests. So there's a huge benefit to that, which really appealed to me about PA.
That's very cool. I love that. And I'm not sure if a lot of people would know that. You think you would stick with one route and get stuck. That's great to know about the flexibility. How about as far as for you specifically, Miss Elise, for you on a normal day, could you paint us a picture of what a typical day as a PA for you specifically looks like?
Yeah, so I'm in that interesting transition from emergency medicine to urgent care, but it's a similar situation that it's pretty unpredictable what's going to come in. So on average, I'll see around 30 patients per day, and chief complaints are ranging from a broken bone to a laceration to infectious disease or abdominal pain, chest pain, and or psychiatric issue concern or social concern. It's really just this wide range of things that come in. So I'll evaluate the patient, decide if there's any sort of, lab work, imaging, EKGs that need to be done, and then I'll evaluate those, and based on that, decide the treatment plan and prescribe medication, send them to a specialist, follow up with them, just depending. So it's pretty quick. You see them for 15, 20 minutes, and then decide what the plan is, make that quick decision, do that, and then move on to the next. So it's pretty fast-paced, pretty rewarding. It's fun.
Yeah, never a dull moment. That sounds for sure. Wow.
Yeah, absolutely.
What are some of the favorite things about your job that you enjoy?
Yeah, I think there's two big things that brought me into the job, and they kind of keep me very grateful and happy with the job, regardless if it's a tough day or a challenging week. I wanted to go into a job where I would continuously be learning, kind of lifelong learning. And every day, there's always a case or a presentation that I'm like, I've never seen that before. Even having, so many years out of experience, or just people present differently or bring up a question, and there's always like continual learning. Or even right now with COVID going on, it's completely novel virus, and there's a ton new to learn about it. And I love that part of the job. But also I knew when I was first exploring what I wanted to do career-wise, and I knew I wanted to work with medicine and science, when I was debating, do I want to go down the research route or do I want to go like PhD, that I really, really wanted to work with patients, and I really value being able to have that patient relationship and being able to help people is kind of a generic way to say it, but really I don't take it for granted that it's vulnerable to be a patient. And I like being in that position, and that's really the most rewarding part of it. Working with patients is a really privileged position to be in, because you're seeing them with their emotional, physical, sometimes worse, and their personal concerns and their intimate concerns.
That's amazing. Well, thank you again for all the work you do to help people. I super value your time, and on behalf of myself and all the students, we want to thank you for your time. Before you leave, one last question. Do you have any advice for our high schoolers that could be watching and listening in on this right now? Anything at all?
Yeah, I would say the biggest thing, and it sounds really simple, but by high school, kind of what interests you have, and just to explore those as much as possible with the volunteering or shadowing an adult in the field that they do, even if it's something that you didn't think, or just talking to adults about their process and how they got to where they are today or what they did. I know it can be intimidating to reach out to adults or different organizations to, say that you're interested and want to come in and help or do something, but kind of the worst thing they can say is no. So it doesn't hurt to do that. And just that it's okay to not know what you want to do, that everything I think, I was like a band kid, a sports kid, club kid, and all of that stuff. You don't really realize it at the time, or even like the side jobs that you have, if they're not relevant for whatever career you want to go into, I think they all kind of shape you and help you in the role that you're going to end up being in. So just to not see it as a job or a task or a chore, you really do get stuff out of it and it helps out.
Well said. Thank you. I think
Yeah.
experience is such an important thing. And like you said, I just want to reiterate for the students, don't be afraid to ask those professional adults, hey, could you job shadow? Like you said, the worst they could say is no, and then you move
Yeah.
on. It's not like they're yelling, they just can't help you at that time.
Yeah.
Awesome.
Yeah. Or just exploring something and finding out that you thought it was something different and you actually don't want to do it. Like when I was the CNA and when I was doing the volunteering stuff at the hospital, those were by no means like glamorous jobs, but they really confirmed like I was happy and I got a ton out of it and I felt more comfortable in that situation, and all of that just immensely benefited me later on.
Well, Elise, on behalf of myself and our students watching and listening, and a lot of teachers that also watch these, they just love to learn from everybody as well. We want to thank you so much for your time, and thank you for your service to the world and for helping those patients. You said it beautifully, how it's a privilege, you said, to work with people in their most vulnerable state, and that I'm in awe because of that. So thank you for your time. And with that being said, I'm going to officially hit the stop button to stop recording, and we can
Great.
officially finish this interview. Thank you, Elise.